honestly, if I had family members that were in the department that night, I would want answers. Like, it's just not okay.
The Winnipeg Regional Health Authority confirms an unauthorized individual who posed as a healthcare aide managed to work several shifts here at St. Boniface Hospital in Winnipeg for just over 2 weeks. The health authority says the individual did not have access to controlled medications and professional healthcare staff were around at all times. But the nurse we spoke to says this is besides the point, that by coming in and working at the hospital, the person had access to information and medical records of all patients within the hospital.
This guy came in and would just go to the charge desk in emergency and say, I'm here, this is my name, I'm here to work. And they were like, okay. And he essentially just started working.
CityNews spoke to a nurse who works in the emergency department at St. Boniface Hospital. We've agreed to hide her identity as she fears repercussions for speaking out. She tells us the individual identified himself as Logan, looked to be around 18 to 19 years old, and was acting as a healthcare aide. When he would come in for his quote-unquote shift, she alleges he would do whatever was asked of him. This ranges from treating patients, such as dressing, washing, and changing them. This also involves transporting patients wherever they needed to go, whether it would be for a CT scan or different wards. This has all been confirmed by WRHA. She says staff had doubts about this person, questioning who he was, what he was doing there, and why no one was doing anything about it, especially since he didn't have a name tag. But she says this is a far deeper issue.
Our department is so awful right now for staffing, and we commonly have 10 people in the department that we don't know, whether it's nurses that have been floated down or healthcare aides. Like, it's not uncommon for us not to know our staff. But yeah, there was people that had worked with him a lot of the shifts and didn't think anything of it.
The WRHA confirmed this incident Thursday morning in an emailed statement saying the individual had registered for but did not complete the uncertified healthcare aid program. Therefore, this individual did not meet the requirements but continued to pose as a UHCA. They say the St. Boniface staffing office identified this error early on, told the individual they were not eligible to work, but that didn't stop them from returning to the hospital. Allegedly, the individual bypassed the staffing office and had deep knowledge of the facility, its units, and managers. WRHA saying the individual worked as many as 8 shifts, but the nurse we talked to alleges Logan worked 15 night shifts, not 8, before being escorted out of the hospital by a nursing supervisor. She adds that with his access to personal medical records, this goes against the province of Manitoba's Personal Health Information Act, and says her privacy, along with all the patients' privacy, was breached.
Everything we're doing right now is short-term, and we have to really start looking at long-term solutions.
Darlene Jackson, president of the Manitoba Nurses Union, says this incident could have been avoided if staffing shortages at hospitals wasn't a big issue.
We're finding nurses are are working under such huge patient loads that they have no time for breaks. They have no time for anything in their day except just get out there and provide patient care. So the fact that no one really had a chance to figure it out until we were well into it is not surprising.
We reached out to the province for comment on this incident and received this response. Minister Stephenson was informed of the highly unusual and isolated incident at St. Boniface Hospital and was assured by the WRHA that security measures were implemented to prevent incidents like this in the future. The nurse we spoke to from St. Boniface Hospital says there are many unanswered questions that need to be addressed.
There's multiple issues in the healthcare system, but I feel that when I work, I am still providing safe care to my patients.
The WRHA say police spoke to the individual and determined that there was no harm intended and no further action will be anticipated. City News will continue to follow this story as it develops. In Winnipeg, Alex Karpa, City News.